So in terms of the vaccination pipeline, it's been an extremely difficult start to the program because of the challenges we had with Johnson & Johnson, and also because the numbers of vaccines that were coming into the Pfizer pipeline were relatively limited. But as I've indicated in the last week, both of these has opened up. The minister referred to the COVAX facility and those vaccines that are coming, and the other Pfizer vaccines which have arrived recently, plus the 300,000 doses of Johnson & Johnson, which came last week, and the 1.2 million that arrived last night. Once they land, vaccines go through a clearance process and have to be examined. The cold chain data is examined, plus some of the samples of those batches that arrive by laboratories at the National Control Laboratory. And it's only after that that they get released, and that SAHPRA authorizes that the labeling is sufficient and correct according to what is required. And remember, we have these vaccines for emergency use, so the way in which they are accounted for is a little more stringent than one might normally do with any other medical product. Nonetheless, it does take a few days for clearance before they actually enter the pipeline. And we try to keep 7 days of vaccine in the pipeline so that if there's ever a problem with deliveries or delayed flights or any other logistics hassles that happen, that we are still able to maintain that pipeline and never have to turn it off. We do have a stock visibility system, the same one that Dr. Pillay showed a moment ago, where we monitor the vaccines and the critical stocks, particularly in the public sector, the critical stocks. And all vaccine sites are reporting every day on what is remaining and what has been used, so that we know where the vaccines are in that pipeline. So right now, as of this week, both the Pfizer pipeline is very stable until the end of July, and we know exactly what vaccines to expect for the next 5 to 6 weeks. The Johnson & Johnson pipeline is not yet confirmed. It's just these 1.5 million doses that we've received at the moment. We do not have a delivery schedule for the remainder. The 500,000 doses to make up the 2 million we were supposed to have received when the problems were identified in the US have hopefully will be arriving in the next week to 2 weeks, but we don't have a delivery date for that yet. And we are still discussing with Johnson & Johnson the delivery pipeline for the weeks ahead. Nonetheless, we believe that has been restored and that their manufacturing is now back online.